Hello friends. Alright, today we'll discuss about scabies and its Ayurvedic management. You are in this YouTube channel Enhance Healthy Life with me, Dr. Mir Minhaj Amin. So, without wasting any time, let's start our journey, a new flavor of medical science. Scabies is an ectoparasitic infection caused by the mite Sarcoptes scabii. It is also called itch mite. The mites, their egg, their waste, create hypersensitivity reaction into our skin. The symptoms is itching, generally worse at night, rash, small red bumps and blister and sores. So there will be a loss of sleep. In classical example, there will be erythematous papule present and it look like knots on a rope.
Causative factor. When a female adult Sarcoptes scabii mite, length is 0.3 mm to 0.4 mm, come to contact with skin, it produces proteolytic enzyme, and with the help of proteolytic enzyme, it borrows the skin and enter into the epidermal layer, and a burrow tract created. Inside the epidermal layer, it produces 2 to 3 eggs per day up to next 4 to 6 weeks. Then the mite die and the larva hatch within 3 to 4 days. The hatched larva move to skin surface and spread.
There is another variety of scabies. It is called crusted scabies. It is also known as Norwegian scabies. It is less common. It is generally seen to immunosuppressive patients, those who are suffering from HIV, lymphoma or cancer, or it is also seen to the older patient. Generally, fomites transmission is common in this case. Erythematous present, scaling, crusting and fissuring in hand, feet and scalp are generally seen. Let's talk about sites. From my internship day to till today, I have been seeing many scabies cases, and the most prominent site is the finger web. And another sites are axilla, knees, areola, buttock, genitalia, around the fingernail. It is also seen in the soles of the feet. How the scabies spread? It spread through and prolonged skin contact with the infected person. Example, sexual contact from one partner through another, or through hugging, like through kids to parents or parents to kid. And it is also can spread through clothing, those who share their clothing, their bedding, their towel, or those who share the same furniture. It is very common in crowded area like prison, child care home, family home and hospitals. With all signs and symptoms, when a patient will go to the doctor will diagnose the disease by clinical examination and after taking the family history. In very few cases, doctor will refer to any laboratory test. The name of the test is skin scraping test. In this case, small portion of your skin will be scraped from your body and it will be put under the microscope and the mite or their eggs will be clearly seen. The line of treatment is scabicide to kill the scabies, antihistaminic drug to reduce the itching sensation, anti-itching lotion, and if there will be any involvement of bacteria, doctor will recommend for antibiotics. The doctor will also recommend for washing in hot water all linens, beds and clothes. And it should be dry in highest heat. The patient should be careful about prevent reinfestation and spreading to other. The item which you cannot wash, seal in a plastic bag, keep it out of the way place for couple of days. The mites will die after a few days without food. And now the most important an exciting part of this video is the Ayurvedic management of scabies. Ayurveda, it is an ancient system of medicine originated at the time of Chalcolithic period. The one of the most important book of Ayurveda is Charaka Samhita, and in Charaka Samhita, Vimanstan, chapter number 7, the scabies disease was described as Kapha Pittojo Tok Rog. And if there is any secondary bacterial infection, then it is called PAM. The first drug of scabies in Ayurveda is Neem. Neem is a tree. Its scientific name is Azadirachta indica. It is the antimicrobial drug as well as anti-inflammatory drug. The possible mechanism is the neem break down the cell wall and inhibits the microbial growth. Neem leaf and neem bark, it regulates the pro-inflammatory enzyme activities like cyclooxygenase and lipooxygenase. So it prevents the inflammation, so it is anti-inflammatory drug. Quercetin and beta-sitosterol polyphenolic flavonoids purified from the fresh leaves of neem, and it has microbial and antifungal activities. The main phytochemical of neem is azadirachtin, nimbolinin, nimbidine, nimbin, nimbidol, sodium nimbinate. Method of use: neem decoction, especially Panchango neem decoction. In this case, the neem leaf, its flower, seed, root and bark should be collected in equal quantity and mixed with 4 times water, then heat it. When the mixture will reduce to 3/4, then cool it down to lukewarm and apply it to the affected body part. And if the infection is severe, then an institutionally qualified Ayurvedic doctor will advise to mix Tonkan Bhasma into the decoction. The dose of the Tonkan Bhasma is 1/5 of the neem mixture. It is a very classical method. You can do this, but today the neem lotion and neem ointment also available in market. You can also use it. An institutionally qualified Ayurvedic doctor will prescribe Gandhak Rasayan tablet with this. It is a detoxified sulfur. It has antihistaminic properties as well as anti-inflammatory properties on skin. The next drug is Bidangadi Lauho. The main content of this drug is Bidanga, a herb. Scientific name is Embellia ribes. It has the property of NSAIDs, non-steroid anti-inflammatory drugs, and also the property of anti-helminth. Next drug is Haridra Khanda. This is a tablet. The main ingredients is Haridra. The scientific name of this herb is Curcuma longa. It is anti-allergic, antihistaminic, anti-inflammatory and anti-pruritics. If there is secondary infection, in this time, your doctor will prescribe for syrup Manjisthadi Kath. The main ingredients of this syrup is Manjistha, a herb. Scientific name is Rubia cordifolia. The root extract. In the root, the main phytochemical present here, it is rubimelin. It has anti-inflammatory properties. It inhibits the lipooxygenase pathway. In the root, the phytochemical cytosterol and deuterosterol also present. It has the antimicrobial properties, especially to the gram-positive bacteria. This is all about Ayurvedic management. Please do not try it home because you don't know the right dose and the contraindication. An institutionally qualified Ayurvedic doctor examining you physically and examining your pulse, he or she will decide about the dose. As well as it, like the drug Gandhak Rasayan, It has many contraindication. Sometimes it create hypersensitivity reaction to the body and it is contraindicated to pregnant lady. So please my dear friend, don't try it at home. If you like this video, please mention it in comment, and if you don't like it, then suggest me how to improve myself, and if you have any query, then mention it comment and I will try my best to resolve your comment. If you gain some knowledge, please share it with your friends. So no more for the present. Thank you. Good night.